Hello, welcome back. I'm Lisa Jordan. I work for the Persistent Physical Symptoms Service and I'm a specialist physiotherapist. Within this video we're going to look at seated yoga. So I'm going to show you a few yoga positions that you can do sitting down where we focus on our breathing as well. Okay, and with these exercises just be guided by how you're feeling. Some days you're going to feel better than other days. So sometimes you might be able to do a few more reps of one exercise than another, and that's okay. I just say be guided by how you're feeling. Don't push into pain, but just nudge into some discomfort just to help you to improve. So we're going to start in a seating position, feet flat on the ground. And just imagine that piece of string attached to the crown of your head, just gently lifting you up into a nice tall position. Just imagine your head as a helium balloon floating up towards the ceiling, relaxing your shoulders down by your side and just resting your hands into your lap. So I just want you to start by bringing your attention to your breath. And just noticing if there might be any tension in your body that you could maybe try to relax. Just relaxing through your feet, through your legs, into your bottom, relaxing your shoulders and your neck. So trying to breathe all the way down again to your diaphragm. If you need to check in again, just placing your hands onto your lower rib cage. And just practicing bringing the air all the way down so you can separate those middle fingers away as you breathe in and then bring them back again as you breathe out. So a couple more breaths and then we're going to come into a seated cat-cow stretch. So just bring yourself very slightly forward in your chair, feet hip distance apart, taking a breath in to prepare. As we breathe out, we're just going to make a C curve in our spine, tucking our chin in and just encouraging our belly button to go towards our spine and to flatten our lower back. Just bring your arms down as far as you can down the front of your legs. Inhale, exhale, sliding back up again. We're starting to then come back onto our sitting bones. We're bringing our belly button towards our groin, bringing our shoulder blades back and just lifting the head very slightly. Inhale, exhale again, creating that lovely C curve in your spine, coming forward and just relaxing down into the position, placing your head almost towards your knees. Separating those shoulder blades. And then inhale, exhale, come back up again, back onto your sitting bones, sitting upright, bringing those shoulders back and down, stretching through the chest, arching through the lower back. Inhale, exhale, come back to your rest position. Okay. Next exercise we're going to do is called a sun salutation. And what this will do, this will help to work on upper body stretching and it will also help to bring your oxygen into the lungs as well through increasing the heart rate as we lift those arms up overhead. Okay, so breath in to prepare. As we exhale, we guide the arms up. Inhale, place the hands together. If you want to look up towards your hands, you can, just looking up, getting a little bit of extension through the back. Inhale, exhale as you bring the arms down again by your side. I'll show you in the side position. Inhale, exhale. Inhale, hands together. You might find having your head down is enough, or if you want to just a little stretch back. Inhale again, exhale, and bring those arms down by your side, okay? So really nice energizing exercise to get the blood flow going and to get some mobility moving in your arms and your shoulders. Okay, we're now going to move into a seated half moon. So this is where we start to transition from left to right in our chair. So again, grounding yourself, feet hip distance apart, feet flat on the ground. Again, lengthening through the spine, resetting yourself. Healing balloon as a head, or lifting up through the crown of the head, that piece of string, gaining length through the body. Okay, we're going to start with the right side. So taking a breath in. Exhale, palm is facing up towards the ceiling. We're driving out to the side and just leaning over to the side. Inhale, exhale, come back and rest your hand down. Then to the left and to the right. And to the left. Okay, and that's a nice way of just starting to get the body reaching, starting to work in a side movement position. Okay, so if you struggle with lifting your arm up so high, maybe start on reaching down. Just reaching down towards the corner of the room, or even reaching down to the floor. Just to start to encourage the side bending. Inhale, exhale. Inhale, exhale. Okay, again, you be guided by your breath. So we're not trying to alter the breath with the movement, we're trying to alter the movement to the breath. So make sure that you've got a nice, regular, relaxed breathing and you're encompassing that movement with your breath. Okay. From here we're going to do a child's pose. So I'll show you from the side this position. So this is where we're going to completely relax and just come forward, arms come down by our sides. So resting your arms down. If you've got arms on your chair, you might want to just bring your arms forward onto the front of the chair so they just slide forward. Breath in, exhale. And we're just going to flop forward. Just allow gravity to take you down and just bring your head down as far as you can towards your knees. Relaxing in that position. And then in this position we can really think about our breath as well. So we're looking to really expand through the base of our rib cage here as well. So as we're in this position, really expanding and contracting, getting the oxygen back into our lungs again, and then gently coming up. Now, you might be able to come up independently without using your hands. If you want to, place your hands on your legs and onto your knees, and just gently encourage yourself to come back up again. That's okay. All right, just don't put too much tension through the tops of your shoulders. Don't overwork your shoulders. Keep them nice and relaxed, okay? Inhale, exhale again. If you feel you need to slide down as well with your hands, that's also fine. Just work your way down as far as you feel comfortable. You can even rest your hands onto the chair if you want to as well, just to gently bring yourself up if you are getting any spasms or any uncomfortable discomfort in your back. Okay? So that's a nice exercise to do, just to allow things to stretch off and just allow blood flow, nutrients into your joints, into your tissues. From here we're going to do a little bit of mobility now through the hips. So I'd recommend either using a dressing gown cord, or if you've got a band, or even just using your arms if you can hold your legs. So we're going to do some circles around one leg and then the other leg, and I'm going to use a band. So I'm going to just place the band underneath my thigh, so it's just in the crease of my knee. Again, sitting in a nice upright position, we're just going to lift that leg up, and I'm just going to encourage little tiny circles, keeping your breath nice and regulated as well. And then we can go the other way. And then change. Just lift a little bit off the ground, and then just gently working into that hip. And this is all progression. You know, once we've done some seated exercises, we can then maybe think about doing some floor exercises later. But it's just a way to get things moving, and then the other way. And then relax. Okay. And then to finish off this session, we're going to do a little hamstring stretch. So these are the muscles in the back of our thighs. And when we are immobile, when we don't move as much, they can become quite restricted, quite tight, quite weak. So we're going to look at stretching them out. So, again from the side to demonstrate. Coming towards the edge of your chair with this exercise, and we're going to straighten our leg out. So just straighten the leg out as far as you feel comfortable. Ideally try and get the knees straight, but if you can't physically get the knees straight, just get your leg as straight as you can. And then keeping the back really straight, we're just going to hinge from the hips, okay? So pointing the toes towards you as well, bringing the toes up towards your nose so you can feel a stretch through the back of your back of your calf. Now stretching is absolutely fine. You're going to feel this in movements, okay? And it's part and parcel of lengthening those tissues we were talking about, isn't it? You know, that tension and shortening of tissues because of guarding. So what we're looking to do is try to create new pathways, aren't we, where we're actually lengthening those tissues. So stretching and discomfort's normal, but just avoid any working into any sort of, you know, pain, any moderate pain. So with the toes pointing towards the nose, take a breath in, and then as we exhale, we're going to just pivot forward a little bit. Place your hands onto your thighs if you want to. Inhale again, and then exhale to go a bit further, and hold that position. Inhale, exhale, come back up again. Okay, I'll just do that one more time on this side. Breath in, exhale to pivot forward. Okay, so you see how I'm keeping my back straight. I'm just looking to stretch through the hamstring because the muscle in our leg attaches to around near our sitting bone. Okay, so if you start to bring your back into it, you're just stretching your back, you're not really targeting the hamstrings. We're looking to do that. But saying that, there's nothing wrong with, if you feel your back needs to stretch, then have a stretch. So you can just come into that position as well and enjoy a little bit of a hamstring stretch and a little bit of a back stretch as well. Inhale, exhale, come back up again, and then I'll just show you the left one from the front. Okay, so straightening that leg, pointing the toes up towards the nose, and then I'm hinging forward. So I'm keeping nice and square through my torso as well. I'm not rotating at all, I'm staying forward and just leaning into it. And just hold it for a few seconds if you can tolerate it. And as I say, like with all the other exercises, maybe 3 or 4 of the exercises, but if you can only manage 1 or even 2, that's totally fine. Just into it one more time. And then relax out of it again. Okay, well I hope you enjoyed that session, and I look forward to seeing you soon. Thank you, bye bye.